Dr. Swearingen and Dr. Bartolome's office here is where they perform artistry in cosmetic and general dentistry. Their team is committed to helping you achieve optimal oral health while enriching your natural beauty with custom designed smile improvements. And I can tell you from personal experience, it is painless. Both doctors are members of the American Academy of Cosmetic Dentistry, and Dr. Swearingen is an accredited member. Here's an interview of both doctors answering some of the most common questions that their patients have about cosmetic dentistry. For someone who is looking to have procedures done, how do you find a cosmetic dentist?
Well, it's very difficult to find a cosmetic dentist, Ed, because everybody's a cosmetic dentist. It's not a specialty. Anybody can call themselves a cosmetic dentist. The day after you graduate from dental school, right up to when a person has gone through all kinds of continuing education and spent years and years becoming a cosmetic dentist, they're all lumped in the same package. So finding a good one takes a little effort. You need to look at their education and background. Good dentists can find courses where you actually take patients and treat the patients under the guidance of some of the best cosmetic dentists in the world. Very few dentists do that because it's costly and time consuming, but there are dentists that have done that, so you could find out if they've done any hands-on courses like that. You can ask them to provide you with testimonials of patients they've treated. Ask them for before and after pictures of patients they've treated. And be sure they're patients they've treated, because there are books out there that provide before and afters of patients that are open to everybody and the dentist may not have treated. So clarify that.
So a patient decides they want to improve their smile with the cosmetic procedure. Will you give them a sneak peek at what the final product looks like?
Actually, we do. It's called a wax up. I like our patients to be involved in every step of the procedure. So what a wax up is we take an impression of the existing mouth, the way it stands. We interview the patient. What is it that you'd like to change about your smile? And we kind of recreate that in a mock-up, which is a wax up. The patient is then able to come in at their next appointment and actually visually see in their hands what they might come to expect with their dental treatment. From the wax up, we can make templates. The templates will tell us how to prepare the teeth according to what guidelines we wanted to create a new smile. When the teeth are prepped, we have a template, again, that will allow us to make the temporaries to that same wax up. The patient gets to do a test drive for about 2 weeks. If we need to make any adjustments to the bite, any changes in the shape or the way the teeth look, we can then do that at this temporary stage. We take an impression of the teeth at that point, and then that way we can communicate to the laboratory, this is the final result. Can you make the porcelain veneers or crowns in this way?
And I think where the artistry really comes in with both of you doctors is you try and use the building blocks of a person's original smile to actually improve their smile, right?
Oh yes, absolutely. And every case is different. Some people may have already straight teeth, but their issues are chipping, maybe cracking of teeth, or old filling restorations that need to be replaced, and they want to create a more uniform smile, to even something more complex as to shifting teeth over, rotating them, or closing gaps and spaces. It just really depends on the complexity of the case, what the patient's end result and needs are desired, and how we need to prepare the teeth or change the smile to give them the results that they want.
I know there's a lot of restorative work in my case before we could begin the cosmetic procedure. Is that typical? Are you really concerned with the patient's overall health first?
We always want to make sure that before we do any treatment, as a priority, the health and gums, the health of the patient is priority. So we never want to build crowns or veneers or do a full smile makeover without addressing the disease process or any cavities or gum problems. The last thing we want to do is have a patient invest in their smile and then a few years down the line have problems to where maybe their teeth are affected. So we want to make sure that the health is the priority.
One of the things you do at this office is what's called a wax-up, giving the patient the chance to not only see what their smile will look like, but with temporaries, feel it as well.
That is the part that I enjoy the most as well when we do these smile makeovers. But not every dentist does that. Sometimes they don't go through that process of a wax-up. So it's always good to find out what steps your dentist or your cosmetic dentist is taking to give you the smile you want.
I chose the option of having my cosmetic dentistry done in a couple of long visits, and that may not be for everybody, but I couldn't wait to get it done. And I was amazed at how comfortable the procedure was. How do you manage to do that?
It is a lengthy procedure, but we do make sure our patients are comfortable, that they get the care that they need.
When you use the term porcelain veneer, many people might think porcelain like a china cup that might smash on a linoleum floor. But these porcelain veneers and crowns really are pretty tough, aren't they?
They are actually very durable. I've had mine inside my mouth for several years, and it's the same guidelines as any tooth that you have in your mouth naturally. You don't really want to chew on hard things, chew on hard candies. As long as you know, don't try to open anything with your teeth or use your teeth as tools, you know, just function with the teeth as normal, and they're very durable once they're bonded onto the teeth.
So after a couple days of these, I guess we'll call them training wheel teeth, you get your real porcelain veneers and crowns. And should they feel natural like your other teeth?
If a porcelain veneer is done very well, they can look natural. Now, I'm sure that everyone has seen some porcelain veneers that don't look very good. Most of those are probably monochromatic, one color tone. We work with a really good laboratory. We don't just pick one color for our teeth. We pick, you know, one more towards the gum color, more towards the body, and kind of give it a more translucent incisal edge. We also make sure that our laboratory puts little anatomies on the tooth so that when you look at the tooth, the light reflects it a certain way and the light transilluminates through the teeth. So we go into a lot of detail as far as the colors we choose, the layering of the porcelain from the top of the tooth to the bottom, to the front of the tooth to the back. Also, the look and feel is very natural. And so you can get a good restoration when done properly that can look good and also function and stand the test of time. And that's what we try to do here.